Good afternoon, this is GAC014, Assessment Event 3, Oral Presentation. My name is Carolina Guajardo and my ID number is UVM 41991.
My name is Paola Buenrostro Garza and my ID number is UVM 2002.
And today we're going to talk about the medicine in Mexico. Agenda. We're going to mention the introduction, some improvements in health service, the challenges which include the financial protection, the quality and the equality, the IMSS, the Seguro Popular, some ways to become enrolled, pre-existing conditions, quality of care, a national health program, the technological advances, the international health crisis, which we're going to cover what is it, how it's being spread, and some preventions and symptoms, and how it's being handled. Also, 120 million habitats, Hugo Lopez Gatelli, the important decisions and facts and the dates, the lack of equipment, the conclusion, and finally, our reference list. Introduction. Mexico healthcare services are very low compared to other nations. This can be a huge issue when handling an international health crisis, and it is believed that Mexico wouldn't know how to handle a pandemic because they do not count with the necessary equipment to treat this disease. It is also expected that with the new technologies, these advances will decrease. Improvements in service. When there is new knowledge or technology on medicine, all nations seek to apply to their population uh, this new technology. And the difference is that each nation is going to make a different effort to know how to improve this and to apply it to their healthcare system. Mexico expenditure on health is of 5.6 percent of the GDP, which is very low compared to other nations. For example, the US has a 15% and Canada a 12%. And also the reason of this is because poverty is very prevalent and so many people postpone care. The system is very weak, and the President Andres Manuel Lopez Obrador got healthcare funding in this changed hospitals, medic supplies. Mexico has a 50% of beds in per capita as the US and also as quarter as many nurses.
When talking about healthcare, Mexico faces a lot of challenges. The first one of them is equity. Mexico has an enormous gap. 40 million people live below the poverty lines, and only 2% of the population is rich. For example, if two children are born on the same day, but one of them is born in Monterrey and the other one is born on the southern Indian part of Chihuahua, there will be a 17-year-old gap on their life expectancy. The Monterrey kid will have more probability of living longer. There are also many differences on the technical quality of healthcare, not only between states, but also within states. The quality of the healthcare you will receive depends on the city you live in, the hospital you go to, and even on the date and time. Another challenge is financial protection. It is based on high out-of-pocket expenditures, and this is a challenge because yearly 3 million people face catastrophic expenses due to major illnesses or injuries. The next challenge is quality, and this is considered to be the number one issue on healthcare. According to surveys done to the population, everyone believes that the quality is very low in both the public and private sector. There was a survey done in 1994, and the answers were that according to the population, quality was the major problem with 44%, then insufficient resources with 30%, limited access with 11%, and at the end, high cost with 9%. This survey was redone again in 2000, but now the answer was that the major problem was high cost. This can be a little curious because The last time, well, the first time the survey was done, the high costs were the less of a problem. And it is believed that this change was due to the the financial problems the country faced in 1990. IMSS is the Instituto Mexicano de Seguro Social. It is the Mexican public healthcare system. It is available for Mexican families and foreign residents who wish to enroll in insurance. The the insurance is called Seguro de Salud para la Familia, and all the information is in Spanish. So if you want to enroll in the insurance and you don't know how to speak Spanish, you will need to ask help for a translator or a friend. Next, the yearly price depends on the age of the person who is applying for the insurance, and it is funded by the federal government, the employer payroll taxes, and employee payroll taxes. Before Seguro Popular, only half of the Mexicans had a health insurance. A good thing about this insurance is that the hospital doesn't charge any type of fee when people visit the doctor. Also, it provides help for the poorest families by not charging them anything when enrolling to the insurance. It is believed that the country's health has improved since Seguro Popular was created, and the healthcare quality and access rose from 49.2 in 1990 to 62.6 in 2015. There are two ways to become enrolled. The first one is that anyone who is formally employed must pay their employee IMSS. This is regardless of any other private insurance the person may have. The other way is voluntary enrollment for those who doesn't have a formal job. For example, foreign residents who are retired on the country. It is important to know that all foreigners who wish to enroll must have legal resident status to qualify. If a person has any type of pre-existing conditions, they will not be able to acquire the insurance. Some of these conditions are malignant tumors, congenital diseases, addictions, mental illnesses, HIV, among others. The quality of care is that the hospitals have waiting periods for cases which are not emergencies. Also, the persons that have the insurance because of their formal employment had priority over those who enrolled voluntarily. As I already mentioned, the quality of the healthcare depends on the part of Mexico you found in and also the local demand of the services. Almost all the hospitals come with limited resources, and normally the demand exceeds the availability of resources. It is expected, if a person is interned on the hospital, it is expected for their family to provide support by bringing supplies and amenities, given that the hospital doesn't provide any of these.
National Health Program. It is a quality improvement initiative. This program was developed to address the three challenges mentioned before. The objectives are the diminishing inequality in health, to ensure fair financial, to strengthen the healthcare system, to improve the health status, also to improve the responsiveness. It control and treat occupational diseases, and it is affordable medicine and reliable implants for treatments. The Quality Crusade aims to improve the quality of care, to decrease the variation in the system, and to improve perceptions. Social endorsement of efforts is a key of the Quality Crusade. They choose the word crusade because they wanted for people to understand that this is not involves only the Secretary of Health, but the entire country. The crusade believes that the country should trust to change, and there are new networks, environments, and learning is very important. Healthcare. As my partner said, healthcare in Mexico is provided by public institutions and are run by the government departments, the public centers, and clinics. It is largely characterized by a special combination of the coverage mainly based on the employment status of the people, and secondarily based on the external health insurance. The Mexican healthcare compromises public and private sectors. Both of them have their own doctors, pharmacists, physicians, and their own healthcare centers. The healthcare and insurance seem though to gas, but they are very accessible for citizens. And even though they are not as qualified as in other countries, it is very accessible for you to find a doctor who can treat you. And in private centers, you can find doctors of your native language because of the significant doctors that go study to the US and Europe. There is also a social healthcare security, and it is a system that covers employees in both private and public sectors. If you work for a Mexican company, you directly qualify for the coverage and for the coverage of the Social Security Institute. And this coverage will cover your paycheck. Um, it is very easy for people who want to qualify to the IMSS to sign in. In general, the healthcare system in Mexico is very affordable, and especially for those who have a health insurance. But all services have do come with a price, and it depends of the quality of your health insurance. Technological advances. In the first decade of the 21st century, uh, this brought a number of discoveries, mistakes, and medical advances that have influenced medicine from the patient's bedsides to the medicine cabinets. And these are some of the discussions. In 1992 was created the first hepatitis vaccine. In 1998, the Lyme vaccine. In 2007, some scientists um, learned how to use human skin cells to create embryonic stem cells. In 2014, it was made a trial with an artificial kidney, and in 2018 was created the first saliva test to find out if having heart attacks.
An international health crisis that we are currently facing is COVID-19. But what is it? Coronavirus has existed for some time now, but this is a new type that just emerged and causes respiratory problems. It emerged on China, and the first case in the world was on December 1st of 2019. There isn't an exact source yet of where it came from, but there are many hypotheses saying that it is related to seafood market. But this maybe it's not true because it was proved that the first case of coronavirus wasn't related at all to the seafood markets. Also, even though scientists are working really hard on it, there isn't a vaccine yet. And this virus can be tested through laboratory tests. How does it spread? This virus spread from person to person by particles that are released into the air when an infected person coughs or sneezes. The good thing is that these particles do not travel more than 1 feet and rapidly fall down to the ground. Some of the symptoms may start appearing between 14 days of exposure, and they can be cough, fever, shortness of breath, muscle aches, sore throat, diarrhea, and headache. Some of the preventions against the virus are frequent hand washing, coughing into the vent of your elbow, staying home when you're sick, and if you have to go out, even though you're not infected, wear cloth face covering. And if you also do not try not to touch your face, your mouth, or your eyes. And if you present any type of symptoms, you must call your doctor first before going to the hospital because if it's just a false alarm, it can be very dangerous for you and for the people around you that you go to the hospital. How is it being handled? Mexico has been handling coronavirus in a very different way from other nations. The president was severely criticized for hugging and kissing fans instead of social distancing. Also, Hugo López Gatell, who is in charge of Mexico's response against coronavirus, on April 17 stated that he still wasn't sure about how bad coronavirus was. The government is refusing to enforce a national lockdown and they're not closing the borders. And also, in comparison to the other nations, Mexico has done so little testing. As of March 31, Mexico had only tested 65 people per million, when United States by that time already tested 2,250 people.
120 million inhabitants, advantage and disadvantage. Mexico is a country with 120 million inhabitants, and one of the advantages is that they have a young population, which helps with the coronavirus because it affects elderly the highest. Some of the disadvantage is that this population have a high rate of obesity and diabetes, and which heightens the risk of contracting this virus. On top of that, half of the population lives in poverty. Almost 60% of the people in Mexico make their income through unregistered business, which are the street sales, the plumbers, the gardeners, and taco vendors. The reliance of the people on the streets sales mean that the government couldn't do a lockdown without affecting all of these people. Hugo López Gatell is the responsible of leading Mexico's coronavirus response. Chief Hugo López mentioned that one has found the correct balance between good and with an intervention and minimizing the secondary effects. He's trying to prevent that doesn't occur again the mistakes that occurred during 2009 with the swine flu. He said that the economic loss in this time was directly related to the tourism, the trade, and services. So he defends himself with the argument that he doesn't want to take any preventive actions that do not correspond to the risk that the magnitude of the risk.
Some important decisions that the government has taken is that the president decided not to close the borders because spring break was coming and he didn't want to affect tourism. So he let in thousands of tourists. He didn't do anything to affect the economy, but he did decided to close schools by extending Easter break 2 weeks more. On March 18, the first coronavirus death on Mexico was registered. And at that point, popular tourist destinations were still busy. For example, the beaches in Cancun were full of people. On March 24, the federal government ordered the closure of non-essential businesses. It banned large gatherings and enforced social distancing. Still then, public markets remained open. On March 26, Mexico had 475 confirmed cases of coronavirus and 6 deaths. The government at that point didn't even try to test all potential cases. On March 31, there were 1,000 confirmed cases, and finally, the government decided to declare a health emergency. On April 23rd, there were 1,000 new confirmed cases in a single day, and the president still said that there won't be any type of consequences for those who aren't practicing social distancing.
Lack of equipment. Workers across the country has protested the lack of personal equipment, and they say that this is accelerating the spread of the coronavirus in hospitals and beyond. The hospitals didn't use this equipment while treating a case of coronavirus, and this affect 41 employees. A nurse told the television network that there was no equipment, no mask, no gloves, not any of that, and there was never any of that. Um, as the pandemic gets to the stage 3, in some hospitals they ran completely out of equipment without and augmenting this to the risk. Additionally, the President AMLO has been very criticized for the delay of taking action of this pandemic and as well of the scarcity of testing the country. Also, Hugo Lopez insists that there is no equipment shortage and that the scarcity in hospitals is because of the inadequate use of this equipment. Health workers protest about this, and the leader of the union, Armando Rosales, promised to sue the state for negligence. Conclusion: with the information gathered, we can see that Mexico can handle a pandemic because they do not have neither the employees and the equipment necessary to assist infected people. Also, AMLO and Hugo Lopez Gattelli are not handling this situation as they should, and they are not giving the importance necessary to this problem. In conclusion, the thesis statement was correct, and Mexico can handle a pandemic because of the and Mexico can handle a pandemic, and even though with the advances in technology, they still don't have a good healthcare system. These are our reference lists, and now we're going to follow up to a discussion.
We would like to know what are your opinions on coronavirus. Well, most of all, Mexico responds to coronavirus, like the president or from Hugo Lopez. What are your opinions?
I'd like to say something regarding your question. I want to um, say that I agree with you what you said in your last slide and your conclusion that they were not handling very well the situation, as well as there were a lot of negligence regarding this topic and the measurements that they are taking. And not only them, but as well as the society and the citizens of Mexico that, for example, they are thinking of the idea of having herd immunity will be a good idea.
Yeah, I agree with that.
Yes, I also agree.
Somebody else has an opinion?
I think that the actions that the government took previously, like not having good healthcare systems, are now affecting Mexico in a bigger scale because now they have to handle, well, we all have to handle a pandemic, and due to the bad healthcare system that has been throughout the years, it is not possible for Mexico to do that.
Yeah.
Yes, this was very bad handling, and also the it surprised me a lot how the president and Hugo Lopez reacted to this, even though some other countries already tell us that this was a real thing and this was happening, and even though they doesn't take it seriously.
Yeah, what I believe also is that it is mostly the fault of the president and from Hugo Lopez because, well, they are telling people that everything's right, that the healthcare is good, and that it isn't that the situation isn't as bad as it seems. But those are all lies. Like, and Mexicans should realize that because, as Carolina said, the whole world is telling us be careful, it is dangerous, and but people still listen to the president saying that it isn't.
Yeah,
Anyone
that's
else?
totally true.
Yeah. Do you have any type of questions regarding this presentation?
Yes, I like to ask, well, if whoever wants to answer, What is your opinion about the improvements made throughout the years in Mexico, specifically that you, for example, Carolina, in this case, mentioned?
I think that there has been a great change or impact, but I think that the government or the hospitals, I don't know, they don't know how to improve or to apply it good to our healthcare system. I mean, we have it, but we don't know how to make the use that it needs to be.
Do you have other questions?
And I'm sorry for asking again. Um, Paola, do you think that quality in the healthcare system could be improved here in Mexico?
I believe it can be improved, but it is going to be hard because, well, in my opinion, I don't feel like, well, maybe there's many doctors who are prepared and nurses, but the government do not give them any type of, they do not have the resources to improve. So if they well, yeah, if the government gives the people, well, the doctors and the hospital resources, they will be able to improve the quality.
Yes, also I want to say that a lot of doctors go to study to another country because it's better in other countries, and even though they come back to Mexico, and so we have a lot of good, really good doctors in our country. But as Paola said, I agree that it's the fault of the government that we are not improving.
I wanted to say something. When I heard that
Yeah.
the news said that we were going to be out like in May 30th, I immediately thought that it was impossible since, like you just said in your entire presentation, that our culture and Mexicans are not exactly following those restrictions of staying at home. So I said, like, maybe we're going to be uh, actually out until, I don't know, October. But I want to know, like, what do you think? Like, what do you think? When are we going to go out?
Yes, I personally don't think that like in 1 or 2 weeks we're going to be out. I mean, there is a lot of cases. Recently, I find out that not a familiar but a very close person to me get contagious, and I mean, how are there are still being people getting this virus, and in 1 week we are going to go out like definitely. I don't think that this will help. I mean, if the government approve it, I think that we will get in a worse situation and that we are like right now.
Yeah, I agree with Carolina. I believe that it isn't, well, I believe that we should be isolated and in quarantine for at least a month or more because, as she said, we are, the virus is peaking and we're now like in the final part. But if we go out again, we will just repeat all over again.
Yes, I wanted to ask you personally, what do you think about this method, about the quarantine? I mean, I personally haven't go out, and I think like if everyone's like follow this situation, this method, we could like improve and get out as soon as possible of this issue. And I wanted to know what do you think about quarantine?
Well, yeah, I agree with you. I think it is necessary. I just went out once and I needed to get to the hospital because I got sick. And on my way, I was expecting to not see like cars, maybe just two or three, but there were a lot of cars and a lot of people walking in the street, and I was really amazed. And so I asked my mom if my mom still goes out because she has to go to work. So I asked my mom if every day is the same, and she said yes, and not even like at working hours, like at every hour of the day there is traffic. And so it is really sad. And I think at this point, maybe even until next year, we're gonna be able to go out without with much less risks than now. So I believe that if we go out, I don't know, in August and September, it's gonna happen the same thing. I think it happened to China, that they um, like they canceled the quarantine because there weren't any more cases, but then they went back to the streets, and then they re-fall into another one. So I think that's gonna happen to us if they let us out in August or September. I think we need to wait longer.
Yeah, I agree with you on that point.
Well, if you don't have any more questions, we are going to finish with this discussion.
No, I just wanna say that, well, as you one last question, like, well, Mexico is lifting quarantine in 2 weeks, but well, I believe it's 2 weeks. Are you going out when the quarantine is well over, or you're still going to stay at home?
I'm definitely not going to go out because I fear for my grandmother is living with us right now, and my great grandparents live next door. So I really don't want to put them in danger. So I'm gonna wait until I like it is completely safe.
Yeah. Okay. Well, now, if there, as Carolina said, if there are not any more questions, we thank you for your attention.
Thank you.